I'm going to introduce our panel right now, and I'm going to let each of them speak about themselves. And after that, we're going to talk about our collective efforts as the state on how we use the hospital safety grade. First, I'd like to introduce Rosa Novo, our board chair, and she's with Miami-Dade County Public Schools.
Great, thank you, Ashley. You can all hear me? Perfect. So thank you. Thank you for being here. Thank you to our Leapfrog friends, and thank you to my alliance. This is where the change starts. My name is Rosa Novo, as Ashley said. I am the Administrative Benefits Director at Miami-Dade County Public Schools. We're the third largest district in the nation. I have 62,000 lives that I cover on the active side, 9,200 on the retiree side of the house. My healthcare expenditure is $426 million a year, and I'm self-insured. Can you hear? Okay. Mm-hmm. And I'm self-insured. So definitely, a lot of challenges with that, with understanding what I'm paying for. And thank you for the panel that we had before, because they were up here speaking, and I kept leaning over to Ashley and having a sidebar conversation about everything they said, right on target, things that I experience on an ongoing basis. Because I can sit here and say, I spend $426 million on healthcare, but really, what am I paying for? I'm paying just to have access to care. I do not really know the quality of the care. I do not really know if it's the fair price. So thank you for being here. Thank you for being part of this movement. Also, as the panel said before, is urgent? No, the time is now, right? We have known that this is an urgency that we needed to address, but definitely the time is now to keep our foot on the pedal and make a change in the healthcare industry. Thank you.
Next, we're going to hear from Bill Scharf with Advent Health, and Advent Health is also a member of our Healthcare Advisory Council.
I'm Bill Scharf. Can you hear me okay?
I think so.
Okay.
Yeah.
Yeah, I'm Bill Scharf. I'm the Executive Clinical Director of Quality and Safety at Advent Health. I can see back here, Michelle, a couple of folks can't hear me. That better? Great. Yeah, now I can hear a little bit of feedback. Mm-hmm. So I was born and raised in the Midwest. I had worked with a healthcare organization for about 25 years. The last 10 years at that organization was as a physician change agent, where I worked pretty heavily with quality and safety. But suffice to say, life throws you curveballs. And I ended up looking to go elsewhere, and I ended up in Orlando at Advent Health. One of the things about our organization, and there's roughly 50 hospitals across Advent Health, we have a couple of joint ventures, so we don't manage all of the clinical ones, but a pretty hefty chunk. And that is around 2015 or so, is that our leadership had recognized that there was this sea of red when it came to quality and safety indicators. And they said is that, you know what, we're going to have three goals. And they call them the clinical imperatives. The first is that every hospital should achieve a CMS 4 or 5-star. The second is that every hospital should have a Leapfrog grade A. And the third is that every hospital should be performing the top quartile performance for premiers observed to expected mortality. And so my role, interestingly enough, is I feel like I have about 40 kids in a classroom, and I have my A students, my B students, and C students. We actually have more of a sophisticated names for them. The A students are, we call the Triumph group. They're the ones that, you just tell them to do something, and they always exceed your expectations and do really incredibly well. The second group is what we call a journey, and that is that they're real close to achieving the clinical imperatives, but there's an area where they need to work on a little bit better. And what we do is our strategy starts with empathy, and it also starts with focusing on prioritization. What is it that you need to do to achieve, to be a Triumph Award winner? And then the last group we call them focused. And it's focused because we provide them a lot of extra attention. And really, our number one group of focused are hospitals that we have acquired from other entities that have suffered years of disinvestment, really had poor leadership, a culture that is, really needs to be changed forever. And from my standpoint, I mean, they're some of the most fun to work with because they're gratifying when you build up their confidence. In 2016, when Advent Health first started down this journey, is that we had about 27% of our hospitals were 4 or 5 star. This last July, when CMS released their results, 82% of my hospitals were 4 or 5 star. And from the standpoint of Leapfrog, I only have 72% of my hospitals are A's. I got a smattering of B's and a couple of C's, but suffice to say is that we won't stop until we have to 100% have A's. I can tell you is that I was pretty shocked when Leah Binder called me in February and said that their group had decided, that the Leapfrog group had decided on a new award for exemplary performance by a healthcare system, and that the board unanimously decided that they wanted to give that first Emerald Award to Advent Health. So that's kind of a nutshell, a little bit about the Advent Health story and the work that we've done, largely in Florida.
Thank you very much. And now we're going to hear from Carl Flatley with the Sepsis Alliance.
I'm Carl Flatley, and I'm the founder of the Sepsis Alliance, and I never heard of health grades up until 2002, so that's one of the reasons I'm here.
Do you want to tell us your story?
I'm a little gimpy. I had a knee put in last February, and right after that I died. I didn't stay out long, actually. It was pleasant, it was quiet, so just in case you're wondering if I saw any lights. There were no lights, no angels, it was just quiet. So I have something to look forward to in the future. It'll be quiet. But as I said, I never heard of the word health grades in 2002. I never heard of the word sepsis. You all heard the word sepsis? Well, when I started the Sepsis Alliance, there was only 17% awareness, and now we're up to 66. So, and I started that in 2004. So in that amount of time, almost 20 years, we've done some progress. But in 2002, things changed for me because I practiced dentistry for 20 years in endodontics, root canals. I did 33,000 root canals. You know, think, wow, 33,000 root canals, pretty cool, huh? It was fun. It was good. But I retired. But I never heard the word sepsis. And so when my daughter went in for a simple hemorrhoidectomy and died 5 days later from sepsis, I was upset. I never heard the word sepsis. And seemingly the 5 doctors treating her didn't know it either. We went in for the surgery on a Thursday. It was a weekend deal. I wouldn't recommend surgeries on Friday unless you know that attending surgeon is there, because he was gone, and the other guy didn't want to cover her. There were multiple mistakes. You know, a couple of the first things you have to do is give antibiotics and fluids. She had it on Wednesday. Friday, she had, they let her go home. Later, when we saw the records, when we went to trial, we didn't go to trial, we went to court. Her blood cell count was 17,000 white blood cell count. I could have written a prescription. They didn't give it to her because they were afraid it would cause diarrhea. They lost a liter of fluid. They didn't give it to her either. They ordered a CAT scan. It took 6 hours. I would call it a never event. I hope it never happens to you or your children. And you know, another thing, not one of those doctors came out and said, I'm sorry for that. Not then, of course. And actually, they never called me and said she passed away. They sent the nurse out to tell us. I did have one doctor come to the house and said he was sorry for the income, the outcome. But the others didn't. So we started the Sepsis Alliance, and amazingly, I was shocked when it happened because I was with her. I was with her. I had never seen a person die. And she died in front of me. And with her eyes, it said, "Can't you do something, Dad?" And she left. I've been working the steps lines for 20 years now to do something. And we're getting there. I'll get there. We all will. The doctor next to me, I was stunned. I mean, what happened? You know, he said she's got sepsis. She had sepsis. I said, "Why? I don't know. Sepsis, never heard of it. I did all kinds of surgeries, treated infections every day, never heard of it." He said, "There are lots of errands. Lots of errands. We lose 350,000 people a year to sepsis. And since Aaron died, that makes 7 million people have died." You talk about quality of care and mistakes and things like that. To realize all those people have died. That means 28 million people survived, but half of those have cognitive and other physical effects. And that should concern purchasers and people that run companies. Because when you have these people who go into septic shock, or, well, if they go into septic shock, they really have less chance of coming back to you. But just simple sepsis, which I've had, they may be out for a long time. And the other people who survive and have cognitive effects, they may be out for years. They may have PTSD and be out for a really long time. So you're going to lose employees. So I want to thank Leah, because in the grades that she has out, the scorecards and such, she's covering sepsis down, what you get after surgery. Well, I can tell you, I went and looked at the hospital. After the lawsuit, they've improved their grades. And I used that money to start the sepsis line so we could prevent other people from dying. I held the hospital responsible. And at first they didn't want to talk. And there were 5 doctors, and they all lost. They still didn't say they were sorry for the outcome. But their grades are improved, so I'm not against suing if you have to. But we want them to do the right thing so we don't have to. Let me just quickly give you a couple facts, then I'll quiet down. But since I'm here, I might as well tell you, because you need to know this, because it's affecting your employees, it's going to affect you. And very few people, even though they've heard the word sepsis, there's only 12, because we did a survey, and only 12% of people in the country know the common signs of sepsis, so you need to know that. 72% of people know about stroke. There's 12% know about sepsis, and it kills many more people. But as far as your business is concerned, what you should know is the cost of sepsis management ranks highest among other admissions. So you need to educate your employees too, because they're working for you. The average length of stay is 75% longer than any other condition. The quality of life and life expectancy is less. And tell everyone else about sepsis. I've had sepsis, and my daughter actually saved me, I think. Thursday night, had something going on, felt like maybe urinary tract, pain in the groin, felt nervous, uncomfortable, temperature. I better go to the hospital. So I go down, the doctor says, he'll run some tests. And so I ran some tests, and they came back and said, you got a UTI. Okay, he said, I'll give you some antibiotics, you can go home. I said, I don't want to go home. He said, what do you mean you don't want to go home? I said, I'm concerned about sepsis. He said, oh, you don't have to worry about sepsis. I said, I'm not going home. He was so mad. Boy, Okay, so I went to my room. I was there for 11 days, had 2 surgeries that weekend. I was on antibiotics for 40 days. And he said, you don't be concerned about sepsis. So I'll leave you with this little part is, when you go to the hospital, tell them you are concerned about sepsis. I don't care if they say, how are you doing today? You tell them I'm concerned about sepsis. You tell everyone you're concerned about sepsis. Receptionist says, what's your social security number? I'm concerned about sepsis. I'm telling you, they just kind of like forget. but you have to. I had it on the back of my truck for a long time. I drove around, put it on the back of my pickup truck. I didn't have a Gator sticker. I'm concerned about sympathy. So I just want to say that. Thanks for putting that in. That's going to help us a lot. Thank you.
So I think a reoccurring theme that we've heard today is to advocate for ourselves as patients and to advocate for ourselves along policy lines and things like that. So picking up on some of the other themes we've heard today, let's start by talking about our various experiences with the hospital safety grade. Rosa, can you talk about the impact of patient safety on your plan?
Sure. Thank you, Ashley. And thank you for coming today and sharing. Thank you. When I was first introduced to the safety grade, it was through my alliance. And it was such an eye-opening experience. Had no idea what this meant. Still learning today, but back then definitely had no idea what it meant. And it was detailed information that really gave me that insight, understanding of what was going on in the hospitals. Information that I couldn't find on clean data, information that I couldn't find on my benefits consultant data warehouse, information that empowered me to have conversations with my healthcare carrier, my ASO, and the hospitals when I sat at the table. And I'm a true believer, and I have shared this today a couple of times with some friends in the audience. I'm a true believer that hospitals want to do what's right. When I meet with hospitals, middle management, a lot of them don't even know about the grades. So to me, it was that eye-opening experience, and still today, right? It's amazing what we can tell from this data. I also am constantly educating our employees on the grade, educating our employees on understanding what does the grade mean. And it really has come a long way for us. Employees are asking the right questions, and hospitals now is a different conversation when I sit with them at the table.
Bill, how do you use the hospital safety grade with providers to improve quality and safety?
Yeah, so a little bit about this is that I mentioned a little bit about our conceptual framework of how we had the different groups. Especially for our hospitals that are like C student, the C group grades, what we'll do is an assist visit. And I and maybe someone else on my team, we'll go out to a hospital. We'll spend about anywhere from 4 to 6 hours at the hospital going through, meeting with their C-suite team, with their CMO, CNO, their quality department, and then we'll also meet with their medical staff. And especially with the medical staff, you know, one of the first questions I'll ask them is do you know what Leapfrog is? And you know, sometimes you get that glazed look. That's you've all seen that, haven't you? And then really this is directed towards the chief medical officer, because the chief medical officer, you know, our ask is that you know, y'all need to have all of your med staff be aligned. There should be a standing agenda item on your MECs. You need to be able to talk to your med staff to say, you know, what is it that they're going to do? You know, have an ask for them to step up to the plate so that they can be active participants towards helping with safe care. And hand in hand with that is that another thing that Advent Health is doing is that we have what are called learning engagement system boards. They're big 55-inch monitors almost on almost all of our units, and that's where the safety huddles begin. And so the other ask that we have for our chief nursing officers, and that is that where's the Leapfrog grade for your CFOs? And, you know, they give me this like, you know, what do you mean CFOs? I'm like, well, you know, your nurses are your chief family officers. They decide where the care that they get, where the care their spouses get, where their kids go, often where their parents and their friends. And if I were to go up onto your floor, and speak to your nurses. Number one, do they know what the Leapfrog grade is? Because they direct care to others. But the second part, and that is that what is it that they're doing that has an impact on the grade? Because at the end of the day, we definitely need leadership, but we also need alignment.
Next, we're going to change our focus and talk about employers and how they use the hospital safety grade. I'm going to start with this conversation and talk a little bit about what we do as the Florida Alliance and how we work with our employers. We tend to look at the hospital safety grade as two parts. Part A is the actual grade, and that's easily translatable to the employees. But as the individual measures are very much more powerful for the employers to help identify preferences between facilities. We also host with our hospital partners hospital meetings where we use the safety grades and the individual measures as a level set to be able to have meaningful dialogues about quality and safety. A lot of times when we meet with the hospital systems, they'll come and they'll talk to us, not with us. And so by having that level set and we prepare with the hospitals, we tell them what we're coming in to talk about, we share the individual measures with them, that's a level setting exercise that we do. We also look at it as what can we as employers do with the hospitals to help prevent, say, hospital-acquired infections. Some of our employer members have navigation services or concierge medicine. So we talk to them about, do you use the surgical wash? If so, let's get with our care navigators to make sure they can be expecting that and talk through with the patient or the employee how to use that. It's really a two-sided conversation to really, help drive home the fact that safety is in all of us. So Rosa, can you give some more examples of how you work with the safety grades in the hospitals?
Yeah, thank you, Ashley. I have also participated in those meetings with some of the big health systems in my area and throughout the state of Florida via virtual meetings. But I use the safety grade to have that conversation, like I said before, with the hospital to fully understand where are areas of improvement. And like I said, for some of them, when I've had those conversations, it's been also for them that eye-opening experience. I think that everything is not about the cost, right? We have to talk about what is the cost associated with quality and safety. And when we talk about quality and safety and cost, there's not a direct association, right? I have, for example, in my area, I'm not going to mention hospitals, but I have hospitals that charge up to 600% above Medicare allowable. And they don't have the A grades. So very difficult conversations that I'm having with them. It is conversations that are ongoing. Pre-COVID, I would meet with them on an annual basis. I would also bring in my healthcare carrier, full transparency, and my benefits consultant, in addition to the meetings with the Alliance, with my Alliance, and with other members within the Alliance. Post-COVID, right, the focus was in the delivery of care, taking care of patients, and we all play a part of that, right? We all had to pivot, and they pivoted as well in the delivery of healthcare. But now we're planning on, we have started to reschedule those meetings. And like our friend from Advent said, right, our next step is really bringing in our CFO, our C-suite. I am a benefits department, unique to other school districts in the state of Florida. I report to the CFO. I don't report to an HR department. I am a finance department. And everything I do, I have to demonstrate the financial impact. So it ends up being that actual, valuable action plan conversation. And that has really worked for me, showing my upper management, my C-suite, what is the cost of the delivery of healthcare, and look at the grade they have, right? And I think, like I said, and I'll say it again and again, I think healthcare systems, I think hospitals want to be that partner. They have a business to run. But I think they're at that tipping point, and the time is now, of understanding, right, that there is a cost to the delivery of care, but what is that cost? And on top of the fact that it's a cost that they cannot even tell you, how do they come up with that cost? So it's a very active conversation that is ongoing. I also use it with our employees, right, when I have that opportunity. We are working in including it on our 23 website. more information on how to access and how to navigate the system. So the work is just beginning.
And Bill, I have to say, you have an impressive program of the continuous quality management in the Tampa market. You and I were talking about this earlier. So I want to say it was maybe 2018, 2017, I was invited to your Tampa area Leapfrog meeting. And some of you may have heard me, I know if Missy Danforth is around, she's heard me talk about this before. I think it's a very interesting concept on how you do it, and I think it's paid off with the number of A's that you've had. Could you speak a little bit about that?
Yes. So if you have to think about Advent Health, I mean, we have hospitals that are in Georgia, North Carolina, Kentucky, Texas, Kansas, Wisconsin, Illinois. But far and away, our biggest group of hospitals is in a pathway that is along from just north of Daytona Beach all the way down to the Tampa market.
We learned in the election it's called the I-4 corridor.
Yes, it is the I-4 corridor. And you guys, get out your smartphones, go ahead and type in Advent Health and look at the map functionality, and you'll see where we stand. Here's one of the things is that what I'm trying to articulate, and that is that because there's so many different hospitals, there are different. We actually have 3 different regions, and the region that you're talking about, Ashley, is the West Florida region. There's back in 2015, when the clinical imperatives were set down, there's one incredible leader. Her name's Robin McGinnis. Robin's back in Florida. The West Florida hospitals have just changed over to a new EMR on Sunday, and it's so yeah.
Oh, right now.
Yeah. So it is all hands on deck for them. But what Robin did was she pulled in the quality directors of each of the hospitals, and they took a chapter one at a time, and whether on season, off season, survey period, outside of a survey period, and they said, okay, what are the questions? Where are our pain points, and how can we help each other? And Robin will admit, she says, this is my favorite meeting. That of all the meetings I attend to, my favorite meeting is the Leapfrog meeting. And so she sits over that, and with that has created a level of standardization and excitement. There's a couple of things that have also happened. Number one is that because of their successes, Advent Health has become what I guess you call a narrow network. We're not completely, it's not something that we have complete throughout the corridor, even though other hospitals are doing well. Another thing that has happened, and that is that some of the quality directors, they love this survey. They love becoming that local expert. And when Robin Naby contacts us and asks for for a set of eyes on drafts, I farm this out to some of my folks, largely in the West Florida division, because they really know that I know that they can check every dotted I and crossed T. There's another piece too, and that is that I don't really know what happened, but I kind of think that there's been a halo effect, and that is that when I was first started my position, I was asked to do a presentation to our board about Leapfrog. Now, keep in mind, this is just 2 years, 3 years into this journey. And what I did was I got a screenshot of a map of Florida for our hospitals, and then put it in a PowerPoint and had it for a board presentation. Last year, I was looking through that old presentation. I'm like, geez, there's a lot of hospitals. There's like a whole bunch of green that's in the Tampa Bay market that wasn't there a couple of years ago. And so I think that there's been this halo effect, is that once you get out and we start advertising pretty heavily, other hospitals are like, well, maybe this is something that we should be doing too. And to that end, I applaud all of our competitors. We will always collaborate on quality and compete on results.
That's a good motto. Looking forward to the next 10 years of the hospital grade, what do you want to see? And Carl, I'm going to start with you.
Well, first of all, I said I didn't know anything about health grades. Well, I I do now after 22. I just had to use it myself. I was down in the Keys. I was doing a fundraiser. I ride one of those recumbent trikes, lay down for lazy people. So I rode back and forth, did whatever, how long it was, 200 miles or something like that. And I was getting ready to go home last day. I got 4 o'clock in the morning, I get a pain again. I thought, here we go, UTI, something's going on, it's crazy. So I get my computer out and look up and health grids, and closest hospital that's A is 100 miles. That's in Miami. And I looked right there in the Keys, there's about 4 of them. One of them wasn't doing anything, and they were smaller, and it was sepsis. It's better to go to, usually better because they see more patients. So I thought, oh, this isn't gonna work, can I make it home? So then I have to go to Google Maps and go 400 miles, got this kind of pain, I'm gonna go for it. So I went to Trinity Hospital, which I'd been before because they were quality. They were so nice in there. I didn't know the first time because I didn't have that much done about, any safety, but boy, they were nice. That's important. Doctors need to be nice because they'll get sued more if they don't. That's the truth. Anyway, so I walked in the emergency room. Here's a big A, big signs on the wall. Hey, yes, I hit it. And then again this year, I was going to ride around Florida. I got braver, and I got the new knee, which is not working anyway. So I was going to ride around Florida, and I got about halfway, so I did about 1,000 miles, and then a hurricane was coming. And so I had to turn around and go back. So I'm going A1A, my little trike and all the cars. And I look up, and there's an A, and it's his hospital. Got the big sign right there in A1A. Yes, good to go. I didn't have to go there, but I was glad to go there.
Carl's referring to Daytona Beach, aren't you?
Yes, it is Daytona
Which
Beach.
is the only straight A hospital in all of Florida, and the only one of our straight A hospitals.
I almost
as
pulled
well.
in.
So it is a sight to behold.
So what do I want to see in health grades? I'd like to see more on sepsis. That's a personal thing because it is the big killer. I mean, it's the #1 cause of death in the hospital. 1 out of 3 patients that come out of the hospital die of sepsis. So it's a biggie, and it's so expensive, and it's not a good death. I can tell you that. When you see what sepsis really is, it's not good, and it's preventable. People don't realize that. It's preventable. It's 80% preventable. And that we know how to treat it. It's antibiotics and fluids and supportive care. That's it. We know how to do it. We don't need a drug. We just have to do it immediately, on time, quickly. And the patient has to know it. Everyone has to know it at home because 87% starts in the community. So when you get and it can come from anything, a fever blister, a tattoo gone bad, an earring, the flu, COVID did it. Any infection can cause it. So if you recognize it at home, you've got to know the symptoms, get to the hospital quick, because if you sleep overnight, get up the next day and decide, now I feel better, I'll go in, or I slept all night, I'm rested. By that time, you're progressed down the line. Now you're getting closer to severe sepsis, and you're not going to make it. So you got to save yourself by knowing the symptoms and getting there fast so they can do what they have to do. And they can do it early, and they have to do it ideally within 1 hour, and they get fined if they don't do it. And that's made a big difference. Once CMS came in and said, you'll get fined if you don't do it on time, went right up. So that works. So yeah, I'd like to see everyone know something about sepsis. And the grades, they'll all get A's. I'll give them an A.
Rosa, can you talk about how you are going to educate your employees and patients in their role in the healthcare system? I know that's a loaded question.
Yeah. So 2 years ago, in the middle of COVID, right, a lot of challenges we all face. How do you maintain an active workforce who's working from the home, involved in preventive services, engaging in healthcare, and keep them as healthy as possible? Obviously, Zoom, emails, mailers to the home. But back then I said, okay, now everyone is at home. We can definitely get their attention. They're not in the classroom. They're not feeding our students. They're not transporting our students. The police force, we have our own police force. We have 500 cops. They're not out there patrolling the schools. We have their undivided attention. So the goal is to start now transforming our district. And in that transformation, what I have started to do is also including the dependents. Comments made before, so valid, right? is not only the patient, but the role the family members play in that patient's healthcare, in that patient's stay in the hospital. And my goal is that, reaching out more to the dependents of our employees, reaching out more to our employees, trying to make sure that we grab them before they make that final decision. A lot of times decisions on what hospital to go to is based on the doctor, right? And as a result of COVID, at least down south where it's warm, down south, you see a lot of acquisitions, a lot of practices that were purchased by hospitals. So where are the physicians going to refer their patient to? To those hospitals, and that's fine. And hospitals are wonderful, but we need to make sure we have that blunt and difficult conversation about the safety, about following protocols, and making sure that our employees understand it and that their family members are part of that conversation and that decision making. That is so important to me.
So our final question before opening it up to the audience for questions. You all have different points of view. Could you take about 2 minutes and share your goals for how hospitals and employers should collaborate? And Bill, I'm going to start with you.
There's one thing that, well, actually, there's a couple things on my wish list, but
Go for it.
if there's a...
It's Christmas.
So, Ashley, I would love to have all of the folks that are in your group with the alliances to do the What's the Plan challenge. And that is to say is that there are some of the hospitals that have Ds and Fs. Some of the systems have a proliferation of Cs. And what I'd love to have is that the biggest employer or employers call the CEOs up of that organization and say, what's the plan? And to be able to say, be able to drop this comment and say is that, you know what, we've been watching your Cs, Ds, and Fs, and we're not sure we want you as a provider of choice. There's a few words that will send chills up those CEOs. I can guarantee you that my CEO, Terry Shaw, if he were to get a call from Bob Iger, it would get his attention. And I'd also love to come back here in a year, 2 years, and listen to the panel discussion about what's your plan discussion.
How did the What's Your Plan work?
What did your plan challenge, and how did that work?
Yes, yes.
Devious, huh?
Yes, yes. Carl, I'm going to ask you next, but I'm going to change it a little bit because I know sepsis is close and dear to your heart. How do you think employers should educate their workforce on sepsis? Are there campaigns? Are there tactics that the employers can take?
Yeah, there's so much. I mean, our website is sepsis.org, and we have something like 30,000 health professionals that sign up, nurses and such. We've got sepsis coordinators sign up so they can talk virtually across the country. We just got a government contract the last couple of years. Oh, wow, I mean, we started out, it was myself, my retirement plan, and Eli Lilly. That was it. That's all we had when we started. We were up to about 20 national sponsors now. I mean, it's just going great. And the government came in and we worked them around COVID and all of this to help them out and get the information out. So, give me the question again. I got mine.
So how can employers work? How can employers educate their employees on sepsis?
I mean, you can't mandate. We don't even like that word. Can't mandate. But if you had these people work for you, they make your production go. But if you can keep them healthy, I mean, show your love, take care of them. I mean, you probably have health insurance already, but you can reduce your insurance if you educate them. And whether it's a newsletter or I used to send my staff, well, I didn't have 50 people, I had 8 people who work with me, but I sent them through Dale Carnegie. After I knew they were going to be there, when you said, Dale Carnegie, yeah. And the reason why is because I wanted to be friendly with people. And I saw him change, and it made such a difference. I think every doctor, before he graduates, should take Dale Carnegie. And it's a benefit, because again, as I said before, mean doctors get sued. And you're less likely to sue them, but it's more fun to work once I had to take it twice, I was a slow learner. But I mean, the staff changed, and it made such a difference. They were so good with patients. And most of the nurses I run into are very nice. I mean, they're really, the way they take care of you and such. But I've had some that really ought to take that course. But, no, I'm just kidding. Yeah, it's, you do your own newsletter. Get them help in their own. How can you help them? And we try to get a gym membership for them to go, just to keep them going, and it builds camaraderie and they do better. So I just try to make it a team. Obviously, you do it at Leapfrog and you've been successful at it. So anything that will just keep the team happy.
Perfect, thank you. And Rosa, how would you like to see hospitals and employers collaborate?
Healthcare is national, but it's very local. So I would like to be able to bring all of my hospital partners into one room with my local friends, employers in the community, and have that blunt conversation and make a change. Make a change in the delivery of healthcare and make a change for the future of healthcare. We can be those change agents, and I want to be a part of that.
Well, I want to thank our panel and see if there's any questions from the audience. If you could raise your hands and someone from the Leapfrog staff will come up to you. We answered all your questions. Patient Dave.
I was curious, did you say you went past a hospital and there was a big Leapfrog A on
Yeah.
the outside? I have not heard of this. How do hospitals?
Oh, come
I mean,
to
it makes
Florida.
perfect sense to me.
Come to
I
Florida.
don't
There's-
live in Florida,
Well,
man.
come visit.
No, how do
there's-
hospitals get to do this?
They get an A from
How-
Leapfrog, and then they pay to put a big billboard. Some of them do it on their competitors.
Yeah, you can't
And
miss it.
then you
Yeah.
drive to the competitors and you don't see the A, you see the A for the one down the street and
They advertise.
yeah.
So just contact Leapfrog and say, I want to put up my A.
Oh, you got to earn it.
You have to
Well,
earn
of
it.
You can put up your A
The reason those other people don't have signs up because they're a C or B hospital, so they don't do it.
or D's.
I live in Nashua. I live in Nashua, New Hampshire. Everybody talks about the two hospitals as equivalent. One has an A, the other has a D. All right. I think everybody needs to know this, right? So we can get some righteous motivation going for the slackers down the street, right? But so I'm going to go back there and I'm going to say to Hospital A, why don't y'all have a big
Yes.
A?
Yes.
But so we just talk to Leah and you'll set it up, right? Does it cost them $6 million for licensing or something? No. Okay. This is
The
like,
how-tos, talk to Leah and team.
I've been talking to Marty, this is the activism thing, like, let's do something.
Yeah, and if you-
Activism, I mean, others could buy airtime to do the other grades also. As a thought, I'm thinking out loud.
I don't know what you mean.
So,
Advertise the other article that the
exactly. Thank you. So, Hospital A puts a Hospital A up, but maybe a group, I think actually a coalition did this, but it was for the prices. It was Indiana, I think. Indiana Coalition did an advertisement for the prices in the newspaper and ranked all of the RAND cost reports for all the different hospitals and basically listed all of them, and you could see how much they were paying over Medicare. But then they ran an ad in the paper for it.
Yeah, just want to add, in Miami, what you see is wait time. You don't see the D,
In
the C, whatever, you see wait
in
time.
Orlando, all
10
the
minutes
clocks
wait.
went down and all the grades went up.
Yeah, very different.
I'm sorry.
Oh, go ahead.
Raised in Chicago too. University of Chicago always has A on the freeway. So you can see it. I've got a question though. Do you, for big markets like yours, is there any kind of coaching A hospitals and the lesser ones?
Yeah.
We lost
breaking
you a
up.
little bit. Could you repeat the question, please?
So when you have
A big market like yours, do you see any kind of coaching happening between the hospitals that are getting A's and the ones that need more help?
is that
Any kind of phenomenon that's happening?
Inside of one hospital system?
No, between.
Oh, no.
Well, I mean,
you said
yeah,
you.
So in the past
yeah.
2 year, past year,
I have been contacted by 2 individuals from 2 large known systems about how we did it.
Yeah.
And I'll be glad to talk to anybody in terms of how we did it. It's not to say that the way that we did it is the right way or anything like that, but we're perfectly transparent in terms of what we've done. Here's what we're finding, or at least I'm finding, this is just my anecdotal experience. These systems, there is institutional inertia among their leadership in pulling the trigger and just setting that Leapfrog A will be part of that goal. Now, one of the things is that I did have the chance to catch up with Leah when she spoke to the Florida Health Risk Management and Patient Safety Coalition at St. Petersburg last August. And one of the really interesting things, Leah, to be able to share, and that is the percentage of hospitals that now who are responding to the survey that now tie the Leapfrog grade to CEO pay. And that number now stands at, if I'm right, 55%. Is that right? Yeah. And when you first started, it was single digits, something like that. Just really zero, yeah.
Leah, you had a question.
So I was one of those large organizations that reached out to Dr. Scharf, and he very, very much was open and sharing how they progressed on their journey. And I will definitely, I had thanked him at the time, and I definitely appreciate that. But don't be afraid to contact the quality folks, the CMO at hospitals or organizations near you, or maybe not near you, but that have attained that performance that you want. Because in healthcare, really, we share a lot. And I was very encouraged by the discussion. We have put in place a number of the suggestions that Dr. Scharf gave. So I would not hesitate a bit to reach out.
Hi, Linda Schwimmer. I'm a Leapfrog board member, and I also am the regional leader for New Jersey and New York. And I wanted to answer Marty's question. We do that in New Jersey, and what we do is actually really well received. So when we see a hospital that gets a D, for instance, our director of quality will look at their survey data and drill down to figure out really what the problems are that we're seeing in the data. And then we'll look at other hospitals in our region that are doing really well on those particular measures. And we'll reach out to them, their quality people, and ask if we can make a marriage, so to speak. And quality people are great. Those are the nice people in the hospital. And they are always really, really willing. So you people, the people who have come today, they're really willing to share. They want to share. And they do. And we set them up, and they talk about how they can improve and what one hospital's journey was to get to do well on their measures. And some of them now have quarterly calls. So it's really been a great experience, and then they value us as a regional leader and a partner, which is good because it makes it a little easier when they get a D and we're like, why are you getting a D? You can do better. So.
Leah, I think you can go.
I just wanted the panelists to speculate a bit. Why did Florida rank in the top 10 of states? You've come up from lower ranks, sort of middle of the pack. You have any thoughts about why that happened?
I think a lot of it has to do with the market share of Advent Health, and they've been buying towards Tampa and the model in Tampa. I have to say, I was amazed at that meeting because they all come together. They're old school paper. The binders are like this thick. They're all coming in with their own binders for their own hospital. And they literally sit down with the measures and they'll say, okay, I'm having trouble here. Has anyone ever had this problem? And then they all flip through their books and they'll look and they'll be like, oh, we had that same problem and this is what we did. They even go down to the layout of the facilities. My facility is the same as your facility as the layout. So it's almost like it was nothing what I was expecting to walk in and see, and I was amazed when I walked out. And I really think that's a big difference. Just because we have so many, we're the second largest market as a state outside of California for the number of hospitals. So we invite roughly 225 hospitals a year to participate. So that's a lot of hospitals. You have anything to add?
Yeah, I'm just speculating on the halo effect.
That could be it too.
And you know, I know just looking at the Orlando area back in 2018 and now, some really great folks at Orlando Health, our competitors. That's the hospital where the Pulse victims went. They've really done some really great work. And then again, just kind of mentioning that Tampa market is that you look at that map now, it's really a lot more green than it was. And one of the things that when I was telling you about this 2018 map, I also looked at those. What I did was I looked at the hospitals that had went up a letter grade and put it in a purple box around it, out besides of our hospitals, and there were about, I want to say, close to 25 hospitals that had gone up. And then I looked to see how many hospitals had dropped a letter grade, and there was just a smattering, 5, 7, 8, something like that. And most of those out of that screenshot were on the East Coast and like the Melbourne, Vero Beach area that really just did not have an impact. And so what? So here's what I think the lesson is, and that is that if you guys set your standards and get A's, market it, sell it, and you never know. I mean, you will never. I mean, I don't know. We don't know how this happened, but somewhere, some way along the line, somebody may say, you know what, we're tired of having our competitors rub their A's in our noses. Maybe it's time that we need to look at it again.
And I'll add one other thing to that. We did have one health system with a number of hospitals start to complete the survey. So I'm thinking because they started to complete the survey, that boosted their grades to an A. But I don't think we've had more hospitals get grades. So it's the hospitals, like most of the hospitals that don't contribute is one system and a lot of rural hospitals.
We've also had support from the Florida Hospital Association.
Yes.
Yes. So
Yes.
Your state hospital associations
yes.
can help drive some of that change as well.
But I think we're the only state in the country that has their hospital association support Leapfrog.
Really?
Yes. I was whispering that, but I guess I forgot I was mic'd.
I think Virginia and a couple others do.
What did somebody do that made the state hospital association support Leapfrog?
It was a relationship. We've had a relationship with one person at the hospital association for many, many years. Karen Van Caldwell's had this relationship, and she really believed in the hospital safety grade. And we've spoken to their organization. I think the first time we spoke to them was maybe 2013, and we've done it pretty consistently ever since. But we also tie it into, they do a lot of quality improvement projects. So they do a maternity quality improvement project. So we try to tie the Leapfrog measures into that quality improvement project. So it's just not all about Leapfrog. It's about a maternity program. It's about different programs that align with their QIOs.
But did this, pardon me, I interrupt. Did this arise from employers like Disney and others saying,
No.
you shall give us good care?
It really was a relationship, and the people who were running the hospital association at the time believe in what the Florida Alliance is doing, and it was a personal relationship. Oh. Do we have a mic? Sorry.
Last question.
So I'm with Ardent Health System, and you focused a lot on system and the work that systems are doing, and we required about 3 years ago that all of our hospitals complete the Leapfrog survey, even those that we knew would not get a letter grade. Is there any consideration maybe to the panel as well as maybe to Leapfrog on a hospital system survey? Because a lot of what we do at the system level impacts the hospital level. So,
Were you in a meeting this morning? Leah, do you want to address that?
Well, it's certainly something we're looking at, but our fundamental commitment is to by-facility reporting, regardless of if we ever went to a system-wide rating of some sort, we would still report each facility within the system separately, because it is so important to employers and just patients.
Mm-hmm.
You want to know, how does the hospital on my block doing, not how the whole system's doing. So, but it is certainly something we are looking at.
Although I can say is that we did host the Leapfrog Advisory Board, when Leah was down, and my boss, our chief medical officer, gave just a 10-minute overview of Advent Health. And what we did is we had comparison of other systems that we feel that we compete against. Some of those guys were in that room. So that was an interesting discussion.
Well, I want to thank my panel for a great conversation, and thank you all.
Thank you. You're welcome.
My pleasure.
Outstanding panel. Thank you very much. You guys also gave me a great idea for a certain hospital system in Milwaukee, Wisconsin. When Margot and I get back, I think we're going to look into the cost of a billboard and advertise that D right next to the hospital they've been getting for, because I can tell you the general public doesn't know it. They don't know about it. It's one of the things we talked about with Leah. The general public does not know about these hospital safety grades. And I think if there was an Aurora hospital, the one where my mom was injured at, and right next to the billboard it says Leapfrog D, I mean, everybody knows the restaurant thing. You going to go to a restaurant that has a D? So anyway, great idea. I'm going to do it. Oh, and I also want to, Dr. Flatley, I'm deeply sorry for your profound loss. And I want to tell you that because of you, sir, I am now concerned about sepsis. Thank you.